Feeling shaky, dizzy, or suddenly sweating. You might be experiencing low blood sugar and it can be dangerous. In this video, I'll show you how to recognize hypoglycemia, prevent it, and what to do in an emergency. This could literally save your life. Hypoglycemia is a condition in which your blood sugar, glucose, level is lower than the standard range. For many people, a fasting blood sugar level of 70 mg/dl, or 3.9 mol/L, or lower is a warning sign of hypoglycemia. Since glucose is your body's main source of energy, this is a medical emergency that requires immediate treatment. Symptoms of low blood sugar that should be taken seriously: shaking and cold sweats, intense hunger, irritability, mood swings, sudden anxiety or nervousness, headache or dizziness, feeling lightheaded, sudden feeling of weakness. Sometimes, other symptoms may also appear, which can be signs of low blood sugar. These symptoms include tingling and numbness of the lips, tongue, or cheeks, paleness, mild nausea, irregular heartbeat, heart palpitations, restlessness, difficulty concentrating, fatigue. If diabetic hypoglycemia is not treated and progresses, the patient's condition will worsen, and the following signs and symptoms will be observed: confusion, abnormal behavior, such as clumsy or sudden, jerky movements, inability to perform routine tasks, loss of coordination and staggering difficulty speaking or slurred speech, drowsiness, blurred vision, double vision, and tunnel vision. And eventually, loss of consciousness, seizures, coma, and death. What factors can cause low blood sugar? Exercising more than usual. Taking too much diabetes medication. Skipping meals, or eating less than usual. Drinking alcohol. Note: these symptoms usually appear suddenly, and if observed, blood sugar should be checked immediately and necessary action taken. What should we do when blood sugar drops? If the person is conscious and able to eat, immediately follow the 15-15 rule. Consume about 15 grams of fast-acting carbohydrates, then check blood sugar again after 15 minutes. If the blood sugar doesn't go above 70 mg/dl, repeat the process up to 3 times. In this situation, you can use one of the following sugary options: half a glass of natural fruit juice, such as orange or apple juice, half a cup of regular, non-diet soda, 3 to 4 sugar cubes, 3 to 4 glucose tablets, 1 tube of glucose gel, 3 to 4 pieces of hard or jelly candies, 1 tablespoon of sugar, jam, corn syrup, or honey. If your blood sugar rises above 70 mg/dl and symptoms improve, eat a snack containing bread and peanut butter or crackers with milk or cheese to prevent blood sugar from dropping again. If your blood sugar does not increase despite the actions taken, immediately inform someone nearby. Ask for help. Those around the patient should be alert. If the patient's condition worsens and they experience impaired consciousness or a seizure, inject 1 mg of glucagon intramuscularly, usually in the thigh or upper arm. After the injection, make sure to lay the patient on their side to prevent choking in case of vomiting. If the patient does not regain consciousness within 15 minutes after the glucagon injection, immediately call emergency services and report the patient's condition. Important note: if you are helping someone who is unconscious, do not try to give that person food or drink. If a glucagon kit is not available, or you do not know how to use it, for medical help, be sure to call emergency services and lay the patient on their side to keep the airway open. Special notes in specific groups: elderly, Symptoms are usually mild or vague. They often only complain of feeling unwell or weak, and fatigue is the main sign. Accurate blood sugar measurement and monitoring are recommended. Individuals with cognitive/motor disorders, such as Alzheimer's, Parkinson's, cerebral palsy, and stroke. These patients may not be able to identify or report symptoms, so it is essential that caregivers and families pay special attention to them and act quickly when necessary. Medical recommendations. 1. Family, friends, colleagues, or caregivers of the patient should recognize the symptoms of hypoglycemia and know what to do when faced with it. Learn how to measure blood sugar using a glucometer. Be familiar with the 15-15 rule for treatment. Learn how to administer a glucagon injection. Always carry your diabetes ID card, which also includes your doctor's contact number. If you have any questions, leave a comment. All questions will be answered in a separate video. If you found this video helpful, please support us by liking and sharing it. Subscribe to our channel and turn on the notification bell to stay updated with the latest health education content.